Welcome to the Humble Hoof podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. In just 2 months, on October 3rd through 6th, 2024, in Chicago, Illinois, we are having the Progressive Hoof Care Practitioners Conference. This only happens every other year, and we have gathered some incredible speakers and presenters to talk to horse owners and hoof care providers about some awesome topics in relation to hoof health and soundness. Those speakers are going to be Dr. David Rendell, who is an incredible veterinarian who's done some amazing research on metabolic issues in the last few years, and he's going to be talking about obesity and metabolic disease and laminitis. Dr. Jenny Hagen is coming from Europe, and she has some really interesting research on biomechanics and the movement of the horse and how it affects hoof wear patterns and how we can read the hoof to know how that horse is moving and how to adjust our trim and approach to their feet because of that. Wendy Murdoch is going to be talking about keeping ourselves healthy as hoof care providers. And Ida Hammer will also be looking at hoof rehab and how preventing issues is so much easier than rehabbing hoof. And Celeste Lazaris is also coming out, and she'll be talking about how the development of a horse's body can impact its hoof growth, and also how the nervous system and myofascial connection lines can actually affect their feet. So we have some amazing speakers, amazing topics that we're going to be discussing. We're going to be having small breakout sessions. We're going to be having a coffee and coffin bones session. We're going to be looking at some bones from the distal limb and the hoof and chat about them. And you'll get to see some great vendors. I'll be there with a table. You can come chat with me and hang out. I hope to see you there. So you can register at progressivehoofcare.org/conference. And I hope to see you there.
Trying to choose the right supplements for the right horses often feels like a chore, and you have enough chores as it is. Fortunately, there's Equithrive, whose mission is to make this whole nutrition equation easier on you and much more beneficial to your horses. Equithrive's lineup of pelleted supplements are developed with care, backed by science, and a 100% satisfaction guarantee. Not to mention picky eater approved. Whether you need advanced joint care for your equine athlete, gut, or metabolic support, Equithrive is your one-stop shop for feed tub fortification. Do your horses and yourself a favor and visit equithrive.com. Use the promo code HumbleHoof and get 20% off your first order, plus free and fast shipping nationwide. Don't forget to use HumbleHoof, all one word, to get 20% off your first order at equithrive.com.
A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 20% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes, and TPU upper design allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, for 20% off a pair of Treks, use the code HRN at checkout at cavallo-inc.com. In 2022, I went to Colorado for the Progressive Hoof Care Practitioners Conference, and it was amazing. And I actually reached out to Philip Himanka before I went to see if he would be willing to have me ride along to do a mentorship with him so I could see how he approached hooves out there in a drier environment than we have. And I was just super impressed with his knowledge of anatomy and the hoof and how he was helping these horses all around his area to grow healthier feet and become much more comfortable. I reached out to him to see if he would chat with me about something he was passionate about, and I gave him kind of free reign of the topic, and he chose the topic of sole depth. And this is something that I've been really struggling with because, as you'll hear in the episode, I have horses that have plenty of sole depth on radiographs that are just not super comfortable walking around barefoot. And then I have horses that seem like they have thin soles on radiographs that are just out there rock crunching and can move over any terrain and not even flinch. So Philip dives into some of the nitty-gritty of the anatomy of why this might be and what he does to get these horses more comfortable when they have just really poor, unhealthy structures and unhealthy sole tissue. We do kind of get into some more high-level anatomy for the average horse owner. So we do talk about the anatomy of the coffin bone, we talk about the palmar digital nerve, which is the nerve for the back half of the horse's foot. So we might talk about some things that the average horse owner might not be aware of, but hopefully the general gist of some of the things that we do for these horses might come across.
So you were asking me about my how do I got into barefoot trimming and all that, correct?
Yeah.
So actually, well, I was living in the desert and I had hundreds of miles because I was bordering the missile range, and it was a lot of trails without rocks and a lot of sand. So the horses barefoot never had a problem, and they could go for miles. And so I started training for endurance, and then when I had to start traveling to other places to go to rides, they of course asked me to use protection. So that's when I started with the boots, and I started figuring out that the horses did a lot better. And then of course the horses did great where I was barefoot, but when I was into very rocky terrain, they were not so comfortable. And then that's why I got into hoof care. And that was an eye-opener for me at the beginning that hoofs do different in different environments and different conditions, different terrains, and you have to adapt. And what's healthy to one place, it cannot be healthy to another. And that got me really interested in hoofs, and I started, opening my eyes to horses with shoes, horses with boots, horses with glue-ons, horses in all kinds of situations and habitats that came from different places to the endurance rides.
Yeah, and when you said you were living in the desert, did you mean when you were in Colorado? Were you in Colorado then?
No, I was in New Mexico.
Oh, okay.
Yeah, I started riding endurance in New Mexico in my past life. And and I started doing endurance 15 more years ago. And so that's how I started to getting into hoof care. Like one thing led to the other. I had no good farriers there, or zero hoof care practitioners. And so I had to start doing things myself. And that's where one thing led to the other.
And what brought you to Colorado?
Oh, I got divorced. Then I met Kata in an endurance ride in Santa Fe. And that's how I ended up in Colorado.
Oh, wow.
That's how I ended up here. I really want to talk about sole depth. So sole depth, the one thing I want to talk is that I hear all the time that the horses are being diagnosed right and left regarding sole depth. And it's basically less than 10% of the information. It's a very important thing because horses can be comfortable, not comfortable, or have all these lameness issues because of the sole. And the sole not only is a living tissue, but it's also a tissue that conforms through blood flow, exercise, and environment. And it is a tissue that grows and changes over time, and it's definitely not a thing of conformation, because the sole can change you when you move your horse to different environments. And not only that, but different times a year have the environment changes, and the sole tissue adapts. So it's a three-dimensional structure that depends on the health of the corium and the concavity of the coffin bone that also remodels through time. And I want to actually get people more on board of thinking about it as a three-dimensional structure and to read the tissue regarding the environment rather than a two-dimensional radiograph measuring the sole depth from different points. that it's really very, very little information.
Yeah, absolutely. And I totally agree with the, the bone loss or remodeling and the health of the corium. And I think that's something that it's hard because, we have these, like, at least horses that come here or horses that I see that the owners are struggling with their comfort, and we're working so hard with their diet or their management or their trim and, booting or protection to get them to grow sole. But if they have that bone loss, it's really hard for them to grow it. I don't know if you've seen that.
Yeah, no, the eye opener for me was to see the opposite cadaver legs. One of a Bromby horse that has very thin soles, quote unquote, and has super healthy corium. And these horses are the ones that walk all the time. And if he had really sore feet, he would not survive.
Yeah.
And the Coffin ones had a lot of concavity, and he was very healthy. And then on the other side, and the other end of the spectrum, these horses that had all these kinds of atrophy and pedal osteopenia, and of course the Coffin one was so remodeled that it was, instead of concave, it was convex downwards. And that horse had a lot of soul. A lot of soul depth if you start thinking about that, but the quality of the tissue was totally different, because the tissue was not even having those lines of exfoliation. It was just a whole 2 centimeters packed tissue, and the corium was gone. There was no corium.
That's interesting. So you think the corium was gone because of the bone loss?
It's the bone loss, and of course the pulling of the. So imagine if you have your papillae that are like fingers, where you grow where the cells get out and keratinize, and that's what creates the horn in the sole, the tubules, etc. And they're pulled forward. So if they're stretched forward or pulled out, then the tissue goes all over the place, and it's not the same as healthy tissue. And not only that, but if you're damaging that tissue, then just the cells go out randomly, keratinizing, and it's not something that is really organized. And then you have these quote-unquote retained soles that are very easily confused with soles that are not being exfoliated, or they're just there, but they're ready to exfoliate. That's the difference between the sole that is being packed because it's not growing correctly.
Actually, that makes sense with the one thing that I heard Paige Poss say was that it's the density of the sole that matters and not the thickness. And that's kind of always stuck with me because, like you said, we can see horses that have really what seems to be thin soles on radiographs that are really comfortable, and then others that seem to have adequate sole that are really sore. And I've kind of attributed that either to like what Paige says, or is it like a lamina inflammation? Is there something else going on internally that's making them sore? But that's interesting with thinking about it being disorganized or not healthy sole tissue. So it's not providing that protection, right? Is that kind of what you're saying?
Yeah. And it's not only that providing because if you have the corium that it's being damaged, is going to be sensitive.
Right. That makes sense.
And if the coffin bone is so remodeled that instead of even being flat, it's actually convex, then actually the pressure point of the coffin bone, or where the soreness would come, it's or the caudal part in the center of the coffin bone, because it's already remodeled. And so the pain is not coming from the toe; the pain is coming from back there. And that's why those horses with osteopenia, that you have no bone attachment to the lamina, to the wall, and there's no periosteum. The lamina is damaged. There's no rotation.
It's just like complete, like generalized thickening of the HL zone.
Yeah, it's kind of floating. The coffin bone's kind of floating inside the hoof capsule.
So in those horses, do you see them as really sensitive to sole pressure?
No, actually not sole pressure, but they are lame because everything hurts.
Yeah, okay. Because, for example, we have one horse here that has a lot of coffin bone loss on radiographs, really struggles with comfort, even on a very tight diet, needs to have protection all the time. And it's something where we've tried some different things on her feet. And if there's any kind of, seems to me like if there's any kind of pressure on the sole, she is incredibly sore. Like she's more comfortable on a flat tarmac asphalt driveway than on something that pushes up into her foot.
Yeah, because probably the corium is a little damaged. And also, it will be interesting for you to see the radiographs and see that line of the density of the bone.
Yeah, well,
That,
yeah, I have the radiographs, and she definitely has bone loss for sure.
yeah, but how it goes, if it's straight, or you can actually see the concavity of the coffin bone through that line.
Yeah, so the bottom of her coffin bone on a lateral radiograph is totally flat, like to the semilunar arch, basically. It's like she has no
Yeah.
concavity.
So she has no arch, so everything is going to hurt. And probably that accompanies the lack of corium. So if you have the corium that is like a little gel or like a little soft tissue, because have you peeled the sole off like in Paige's dissections?
Yeah.
How it peels out?
Mm-hmm.
And sometimes you have, it's soft in there. It's not really hard. But when you peel it out and there's a horse with problems, with bone problems, basically, that tissue is very thin. It's like you're pushing into the bone. So it's probably not that the sole is creating is bad quality tissue, but at the top, I mean, the cranial part of that, it's the corium that is very thin, and so all the pressure is going into the bone.
So then what do you do typically for these horses? I mean, obviously there's not a way to sort of regenerate that corium if the bone has been lost. So what do you do, or what do you usually see help with comfort in those cases?
Well, what I see that is interesting is that when I do a round of glue-on, being very careful that not to how you call to get that foot to run forward, because that's one of the drawbacks of putting a prosthetic that is not wearing the toe continuously, and then the toe starts stretching forward. So if you do a really good breakover and you have a really good angle over time, then you're letting that sole tissue grow inside a little more. Does that make sense?
Yeah.
Have you done the glue-ons with pads and the whole thing, and then you find when you pull on the glue-ons that you have a lot of exfoliating sole?
Yes, for sure. Yeah.
Okay, so that's probably part of the healing process, but you're probably not going to end up in a perfect situation, because part of the thing is that you're working against gravity. Your bone is already flat.
Right.
And there's no, I mean, I wish, sometimes you wish there was like magic that brings that coffin bone back into density,
Mm-hmm.
But you're working against gravity, basically. And if the horse is not moving, poof.
Right. So then when you do like any kind of package, are you doing ones that like build depth with glue or dental impression material, or are you seeing different horses that have this bone loss, like different kinds of things, like depending on the case? Or what's your like typical go-to for these to see, that rebuilding of some sole, or like at least some extra depth?
Yeah, so I do something with very, very soft packing, and sometimes with just putting the Artemud and sealing it with that VedTech soft in the back, and leaving it a little hollow where at the tip of the frog.
Mm-hmm.
So not repacking too much, but the redistribution of the weight-bearing surfaces underneath, I'm using these felt pads, the ones that you use for moving furniture.
Yeah, yeah.
So it's felt. So that felt actually has a bounce and has a give and a bounce, and they love it. So you're redistributing the weight-bearing surfaces around the coffin bone.
That's interesting.
That makes sense?
Yeah. So do you have like do you just leave a total hollow space under where the coffin bone is, like you're saying in front of the frog, or you put the felt?
Just a little bit. I don't want to put too much pressure there. So I don't try to pack a lot inside. And I found that a little bit by, by accident, because sometimes when I start squirting the packing material through the back of the glue-on shoe, sometimes it doesn't get all the way, it doesn't cover the whole thing, right? It doesn't penetrate to the whole hoof. And then you have space, like gaps. And when you pull the glue-on off, you'd see that the tissue at that or those gaps, it's a little different. So not that it's exactly matching the places where it didn't fill, but you get a little bit more of a sole growth. And then, of course, all that sole that it's exfoliating, it's actually coming off like in chunks, or it's like very chalky. But the tissue underneath, it has a better shape.
So then
Make
do you
sense?
see it permanently helping improve their comfort, or are they in something like that forever?
No. Well, that's the thing. In order to make a change for the future, you'd have to get that growth in a correct angle with more wall, so you can have that coffin bone higher up off the ground.
So then,
Am I making sense? So if you have a good angle, if you are maintaining and you're not chopping the heels off and getting that toe forward, and if you're getting that toe back, you start to see how that coffin bone starts going up inside the hoof capsule, and you have better wall growth. Am I making sense?
yeah. So then, do you typically so? If I were to do something like you're saying, and if you see a better wall growth, are you thinking 9 months until that new wall growth or better wall growth hits the ground, and then would you think about transitioning them to something else?
Yeah, and actually the transition is going to be a little hard because that tissue's not stimulated. It's like, oh, you've been running in tennis shoes and then you want to go walk in the sand.
Yeah.
But you can use hoof armor or other things to do the transition, and then leave a lot of wall so it's off the ground.
Yeah. And do you see, their foot just exfoliate everything out, or do you see them regress at all, or typically does it kind of hold a better structure for a bit?
It holds a better structure for a bit if you're bringing that toe back and if it's dry. But if the horse, you pull it out and you put him on a irrigated pasture, you just go backwards.
Yeah, it's hard. I mean, so we had a bit of a drought really the months of June and July here were pretty dry. And so we had, it was an abnormally dry, just before a drought for us. But in the last week, we've probably had 6 inches of rain just in the last few days. So now everything's wet. Everybody's, shedding out tons of frog and bar and sole right now that they hadn't been shedding for the last few months. And so it's hard, I think, in a wet environment, I don't know, to get them to sort of retain or keep the better structures that they grow, especially if they're on pasture. I mean, that's almost impossible. I feel like horses that are on grass, they're just at a disadvantage with their lamina connection anyway.
Yeah. No, that's the thing. That's why environment's so freaking important. And then the other thing is, of course, they are not exfoliating that tissue because they're not moving in abrasive terrain.
Right.
And then you have those layers of sole material that when they start to come off, the water goes in between those layers, and then you have all these subsolar abscessing and all these problems.
Right. Yeah. Yeah. And I will say, I mean, that's one reason why I've had trouble with glue-ons. I used to have a ton of horses in glue-ons, and I've slowly stopped doing them only because I felt like it was taking me so long to transition out of them. And so I just kind of swapped to utilizing boots and pads, but I don't always see the better structure growing down in those cases where they have the coffin bone loss. But if you're seeing that with glue-ons, then I'm absolutely willing to try them again to get their feet in a better spot, because that's the most important thing to me is getting their feet healthier.
But you have to know that the heels have to be a little higher, and then you have to have a very nice breakover, because anything that prevents that continuous wear and tear of the toe helps everything migrate forward.
Yeah.
And when things start migrating forward, there goes the corium.
Yeah. So do you actually leave the heel not trimmed as much, or do you mean heel higher with the glue on?
Of course, if the horse has no heel, I just put a wedge, or I can do a wedge outside the glue on. I have to leave the heel.
I remember
to lift the heel.
I remember when I did a mentorship with you, you were using the floating hoof boots and you put the glue. I don't know if you still do this, so you can correct me if you don't. But you put the glue on the outside of the boot to add height at the heel.
Yeah.
which I thought was really cool because then you still had the flexibility at the heel and you had support over the entire back of the foot. So the actual height was on the outside. Do you still do that?
Yeah, I still do it, and I tried with one horse that on the hinds that were a little contracted, and that's hard to happen. And in the hinds, and I did a bevel towards the inside of the wedge. So every step that the horse did on the ground helped those heels to open up and expand, because that glue on that I did let that heel expand.
Yeah.
And that horse loved it and finally started growing heel, because like in the hinds, if you go to the point of no return where the horse is walking on the heel bulbs,
Yeah.
and your heel corium is gone, so it's like going against nature, trying to lift those heels off the ground. It worked for these horses, started growing a little bit of heel. You can modify that little wedge in the back like if they were tubules, because you're building it up with a super fast, and then you can rest the inside like if it was a natural hoof, so it will help that shoe to expand outwards.
So I remember, I feel like I keep referencing Paige Poss, but I remember when she said, I think it was at the clinic that I hosted where she taught, and she showed some dissections where the corium underneath the back half of the coffin bone was so distorted that basically the heel couldn't grow tubules vertically. It just didn't have the strength, like the ability to anymore, because of the health of the corium there. I don't know if that's something that you were talking about in terms of, the corium. Yeah.
Yeah, that's why the heels are so important, because if you lower the heels, you're not only you're thinking you're bringing back the center of like they call it the purchase, or the where the horse is standing, but what you're doing is changing the whole angle of the hoof, and so the horse is just putting more weight on the heels, and the toes running forward. So that's why if you have shorter tubules, and then you lean your tubules forward, then the leverage is exponentially bigger. And the more they are, that's why you start getting the on-the-run heels, because the tubules, the only way to grow for them is forward.
Yeah, right. So if you come to a horse that has sensitivity, like you're saying, there's lack of bone health and struggling with all these issues, like, is your first automatic thing to go all in and do like a year of glue-on packages, or does it really depend on the horse? Have you seen any horses that are healthier just with, environmental management or diet management or things like that?
Well, that's why I love that post that you have on Facebook when you say it depends.
Yeah.
So it depends on the environment, it depends on the horse. But the point that I want to go to is that you want to read the tissue, how the tissue is behaving in different environments, what is the shape. It's a three-dimensional structure, first of all. You cannot, with a radiograph with a two-dimensional radiograph measuring the sole depth, it's really, really very, very little information. You need to know all of the rest. You need to read the tissue, how it's growing, how it's behaving, how it's retaining or not retaining, how it's exfoliating, what is the shape of the concavity, where it has the cracks or not cracks. And you've seen soles that are totally like polished.
Yeah, absolutely.
Right?
Yep.
Like polished. And that's very different. And they could be thick or they can be thin.
Yeah, right.
But they're hard.
And that makes me wonder too. I mean, I've had some horses that, shouldn't be comfortable based on their management and how their, foot looks or the collateral groove depth, but they are. And then others who are so tightly managed and you just cannot get them comfortable. And yeah, I guess if it just comes down to the health of the corium, then we just need the bigger guns to kind of help them.
Yeah, exactly. So you need the bigger guns. So that's when you make the decision, and you can make the decision even with a tester. with a hoof tester.
Yeah.
Because sometimes when they're really bad, and sometimes when I pull them out of the shoes, you put your finger and it just flexes.
Yeah.
And the tissue's not growing. And the tissue's not growing because it doesn't have any blood flow and the corium is damaged.
Right.
So then everything that's there, it's poor.
Right.
And then, how can you help that horse? You pull those shoes off and that horse is going to be screaming.
Right. I've actually thought that too about how if they have no depth and they're kind of walking on a flat foot with thin soles, how are they able, like you were saying, if that corium is all compressed, how are they getting circulation to grow more sole depth if they're constantly having pressure on it? So that I've thought that too about giving them relief and building depth so that they can almost have that better pressure and release of the corium to get the kind of circulation and blood flowing around the coffin bone to see if that actually would improve things.
Yeah, and of course, it's interesting because Rick Redden, when they do those
The ultimate
venograms and
wedges.
whatnot,
Yeah.
crazy thing. They say that when you don't have any blood flow on the terminal arch, then it's game over.
Yeah.
But that tells you a lot. That tells you that when the coffin bone is remodeling and just going down, the blood flow of that terminal arch is getting restricted.
Right.
And I've never seen nobody talk about that or hear anybody talk about that terminal arch blood flow and the relation it has with the sole corium and with circumflex artery. I mean, the circumflex artery is a very good telltale about the health of the edge of the coffin bone, but not underneath. So like when you take a picture, when you take a DP, what they call it a skyline 65 degrees, and you see the nutrient foramina that goes through the coffin bone.
Oh, yes.
That is also a good telltale to tell you about how much bone loss you have.
So like in terms of if they're enlarged or what do you, I mean,
if they're enlarged, it means that there's more bone loss because the foramina, it's expanding.
Yeah, that makes sense. I mean, typically, if I'm looking at like that solar margin view, I kind of look for if it seems like it's been chewed, the coffin bone's been like chewed by mice, like the little like pelosteitis Swiss cheese look. But I never thought to look for the actual like, areas where where
the blood flows.
Right. Yeah, I can't even
and then
think.
What happens is that it's related to actually when you have more bone loss, you will see that the coffin bone's flatter. It's kind of related.
Right. No, I absolutely agree. And that's why when people send me lateral views of the coffin bone, that's one of the first things I look for is how flat is the bottom of the coffin bone. And that's something that Pete Ramey used to talk about a lot too when he's done some webinars on laminitis is, kind of thinking about projecting the bone to where it should be. And then you can see how much loss you have based on that, like more opaque white line of the arch that if the bottom of the bone meets that line, you've basically lost the entire concavity of the bone.
Yep, and then you want to measure that the sole depth. Well, it's very difficult because you've seen it how everybody measures the sole depth in a different point.
Yeah,
some people do it at the tip of the coffin bone. Some people go back. There's some people that start promoting it to do a little bit further back. It's very relative.
Or, I know that my veterinarian will say, we'll measure it from the tip of the coffin bone, but then we'll say we have to account for a few millimeters of the corium. So that's not actually the sole depth. It also includes sensitive tissue. So if you have a really thin sole, then you know that it's paper thin if you have to account for the corium there too.
Yeah. And then you can see a little bit of the corium regarding the line underneath the bone.
Yeah.
Okay. But it's not very clear in the radiographs.
Right.
So it's hard to see how much corium you have. And it could be gone.
Right. Yeah.
And could be gone. And you just have blood flow going there. So imagine those cells that are designed to be organized in spirals to create a tubule that they're just dumped.
Sorry,
So that's
you mean,
so those cells that are going to become horn, and if they have a good growing structure, that is the papillae. If that papilla is damaged, those cells that are keratinizing, they're keratinizing randomly all over the place.
okay, that's what you're saying, instead of being organized.
Yes.
Right. So then that's
That
why
makes
the
sense.
sole isn't healthy. Yeah, for sure.
So I wish there was more studies, and more research regarding this. But the interesting thing is that, well, the thing that I want to come across is that we should not be making diagnosis with 10% of the information.
Yeah. And also, I hope that it would make some owners and hoof care providers feel better that, sometimes it's actually a true pathology of, like you were saying, bone loss or, the corium being damaged. So it's not our fault if the horse is struggling despite our best management. But obviously, we should still work to get them comfortable, not just give up and throw in the towel. But
Exactly.
yeah, I think that it's sometimes easy for, at least when I'm working, it's easy for me to blame myself if I can't instantly make a horse comfortable with a trim or diet changes, because I've seen so many horses improve with just that. But obviously some cases are more involved and there's more things to consider, and horses can have varying degrees of sensitivity. Some horses can, handle things better than others. So
Yeah.
yeah.
Well, I'm going back to I don't want to forget to tell you this. So, and you probably know it, but regarding Paige, that study that she's making about that neurovascular bundle, and how that nerve goes right on top the collateral grooves.
Oh, yes. Okay. So I think
So,
she talked about that at the NAEP conference a few years ago, where she was saying, this might not be the same thing, but she was saying that horses that have palmar digital nerve impingement will be really sensitive to collateral groove packing. Is that similar to what you're talking
yes.
about?
Yes,
Yeah.
because you see, you're packing a place where it's just climbing that collateral groove upwards into the nerve. When you have if you have a healthier frog, your collateral grooves are going to be more open, and the tissue on the cuspid, or in the top of that collateral groove, where it meets the digital cushion, or where it meets the caudal part of the coffin bone, that part is going to be pointy and shallow. Make sense?
Yeah.
So if you have a horse that has more, let's see, wider heels, and the collateral grooves are actually more expanded, there's going to be less pressure, or that's a theory. Less or more pressure, depending on how stiff that collateral groove, or is how much into the hoof capsule it's pinching.
Yeah, I mean, that makes sense to me. I know that there are some cases, especially horses that have like caudal hoof pain, where they have pain in the back half of the foot. I find that so many of the ones that I've worked on, if I was putting them in glue-ons, they couldn't handle dental impression material in the collateral grooves. Or at least it had to be incredibly soft, or it had to be like a very soft pour in, because they were more sore with all this extra protection than they were barefoot, which didn't make sense when they had all this extra depth. But the second we took the packing out, they're much more comfortable. So that kind of clicked when Paige said that at the symposium, that it was that like nerve impingement. And so you're kind of putting pressure right on the nerve if you're putting packing in.
Yeah, but then you can do that with the pads. If you have a very soft pad that doesn't crush, that has that give, that's why that material that, and I had the idea actually from Paige, because she says that some laminitic horse, when she puts wool inside the boot, they love it.
Huh, yeah.
So then if I decided to get these pads that are almost wool, that's felt, but has certain consistency. And I mean, they're super cheap and they have a sticky side. So I just cut them off and stick them to the inside of the boot that I'm going to glue, and redistribute the weight-bearing surfaces inside. Super nice.
That's really cool, because I've gotten like old Western felt saddle pads and cut them up as pads in boots, mostly because they stay like they don't break down like other pads that I've put into boots. They actually hold up pretty well. And I found that horses really like them, and I don't really know why. I mean, they don't seem like they're any special material, but that makes sense if it's just the way that it distributes the forces in the foot, then
Yeah, and it has a bounce.
yeah, it definitely does.
So,
Yeah, I've definitely noticed that too.
so when you have a pad that's very soft, but it crushes, it stays crushed. So the next, I mean, when it crushes, let's put it the next day that it's already crushed, the horse is going to lift up the ground and it's going to be the same. When he puts it down,
Mm-hmm.
it's not going to have any bounce because it's already crushed, right?
Yeah.
But this one is going to it's going to breathe a little bit.
Yeah.
So every step is going to be a little softer, a little harder over time, but it's still going to give you a good amount of time.
More
of comfort.
support.
Yeah.
Yeah, that makes sense. And did you say that you noticed differences? I mean, obviously there are differences between the front feet and the hind feet. I know that we had kind of talked about that on Messenger a little bit. Were you saying that in terms of like sole depth and rehab, or just in terms of like how you approach the feet themselves?
Yeah, no, I think that you have to understand the whole enchilada about the difference from the fronts and the hinds, and there's not a lot of attention in the hoof care world about differentiating fronts and hinds. And the fronts, of course, the horses walk in the fronts like humans, and in the hinds they walk like an ostrich. So definitely those two gaits are just totally different. The fronts land on the heels and roll. The hinds actually slide under the fronts. So when the front lifts, the hind comes under.
Oh, yes. Okay, yeah. I know what you're talking about.
Instead of hitting the ground like the fronts do. Then the fronts, of course, have 70% of the weight of the horse, and the hinds not so much. But at the same time, the way I call it the angle of approach of the bony column into the coffin bone. So in the fronts, you can see that when the horses are starting to get laminitic, or when they start getting or long toes, the toes going to run forward. But if you have long toes in the hinds, meaning that you have negative plantar angle, that toe is going to curl down because the pressure of the coffin bone is caudally.
Yeah.
So the tip of the coffin bone is going to be higher inside the hoof capsule.
Right.
It's not going to be coming down. And that's why you find a lot more concavity in the hinds than in the fronts. Okay? And then the bull nose it happens on the fronts only if you have a tendon or an injury.
Right.
A tendon injury or something that is really bad or wrong. But usually the fronts will just, when they're long, they'll just go forward or pancake. And the hinds kind of start getting that parrot nose, because that coffin bone, the pressure of the coffin bone is not towards the front, it's towards the back.
Yeah.
So the tip of the coffin bone in the hinds actually has pressure upwards instead of downwards.
Yeah, and that's something that I've shown to owners or PHCP students who come, that, you know, if they're looking at that hind foot and they see, like you're saying, that like bull nose or bulge. I just don't know if owners are listening, if they would recognize that. So just explaining a little bit about, like, if you're seeing that foot just bump out and round on the hind feet, then you can assume that the coffin bone's just tipped backwards in the hoof capsule. But I never really thought about the fact that the front feet, you really don't see it. I mean, I don't think I've actually seen a bull-nosed front hoof. I'd have to like literally go through my hoof photos to see if I have. But I've seen plenty of bull-nosed hind feet when I first come to them that have dealt with negative plantar angles. And the cool thing is watching those improve as you get the feet healthier and get the angles better, and then that bull nose goes away. So that makes sense that there's that difference between the hind feet that makes them more predisposed to get that if they're low angled.
Yeah, because it's creating pressure in the coffin bone caudally. And that's why those heels, you will find a lot that the heels on the hinds will flare out more than in the fronts.
Okay.
Not in all horses, but in many that are negative. So you start seeing the bull nose, and you start seeing, especially like in drafty horses, how those heels actually flare out. And what Paige says also that's really interesting, if you don't bring those heels in from the top, then the ungular cartilages will start pinching in.
Huh, yeah. That's interesting. I mean, I was going to say that I often see that like flared heel on DSLD horses that are overweighting the back half of their foot.
Yeah, that's a pretty great example because everything is loaded caudally.
Right. Yeah. I mean, there's just like a whole breakdown of the limb that's putting pressure down there. So Yeah.
And if you have the hind hoofs that are sliding underneath the fronts, meaning that they're wearing their heels more. So if you trim those heels in the hinds on horses that are doing that, you're very close to have no heels very soon.
Yeah, for sure. I find that most horses that I see, I don't, at least for, I feel like I shouldn't say this because I never give trim advice remotely because every horse is different, but most horses I see, I rarely have to trim their hind heels because they maintain them. I'm almost always working
Exactly.
on the toe. Yeah.
Yeah, and when you find them that they're really low or they're just walking on the heel bulbs, they're like super hard to rehab.
Yeah. Yeah. And well, have you seen that correlate to issues higher up? Because a lot of times I feel like there's an issue higher up that's leading to them just crushing their heels or standing under themselves enough where they're just not able to actually get a good tubule like on the back half of the foot. Have you seen that?
Like you regarding upwards on the body of the horse, or
Yeah, like something higher up, like if there's a SI issue or
oh
pelvic
yeah,
issue.
yeah, definitely. Imagine so it's all the whole flexor process that goes to a huge muscle on the butt, like on the pelvis and everywhere. So what happens is that if you have a little bit of more tension on that dipteral flexor tendon on the hinds, it's exponential as you go up.
So you're seeing, do you see like I feel like, I mean, I guess it's chicken and egg, but I typically think that the issue higher up led to them crushing their heels because they're shifting their posture. But do you see the feet leading to, like, causing issues higher up, like the feet being the cause?
Well, yeah, like you say, it's the chicken and the egg. But if you can create the problem upward if you lower the heels too much.
Oh, yeah.
And then the horse is that, or if the horse has an issue with, I was with Christina Klein not very long ago, 2 or 3 weeks ago, and she was showing me some pelvis of horses that were started too young, that are started closing in into the spinal process, creating pain. And so you start having pain in that pelvis area or in the back, and the horse has started to go inverted, then what happens is that you have more tension of that flexor process all the way down to the foot.
Interesting. So if they're started too young, that's so, I mean, I believe it that starting horses young can cause a lot of issues. But yeah, that's really interesting that she has, what did you say? It was like a skeleton, or what was she looking at?
Yeah. She has two pelvises of horses, the skeletons.
Wow.
And then she's looking at I think one of them is even fused.
Wow. Wow, that's crazy.
Yeah, it's kind of crazy. So yeah, problems up can cause a problem down, or like horses with stifle issues, that's the flexor process, and they just don't want to, they bear the weight on the hinds differently.
Yeah, that makes sense. So do you have any advice or tips for hoof care providers or owners in terms of like either sole depth or just hoof rehab in general?
So yeah, in general, the thing is reading the tissue, knowing what you have in 3 dimensions. And if you add time to it, the 4th dimension will be how it's growing and the environment. So if you can read that instead of just taking for the sole depth as a consideration, you're adding more to to the knowledge of what's happening in that sole. So if that sole is compromised because the cophemon or the corium or the environment or the thrush, or that is the horse is not moving or is not exfoliating, everything can contribute to that pain in that part of the hoof. Make sense? So just not take it for granted, sole depth or whatnot, to actually start to look into the tissue and how it behaves. How it exfoliates or not in different instances. And I'm going to put an example. So horses right now, they say is the season that that they have a lot of sole that is not exfoliating or is about to come off. And it's because these horses are not moving a lot and they're stumping a lot because of the flies.
Mm-hmm.
So they're stumping, there's more blood flow, there's more rapid growth on the sole corium. So there's more blood flow, you have more tissue growth, and that growth of tissue is not going anywhere because the horse is not in an abrasive terrain. So if that horse was moving a lot, that tissue that's about to exfoliate will be exfoliated. But if the horse has not a lot of movement, then that tissue is there and it's coming off in layers.
Right. So, but don't you usually see, I mean, I feel like if I have a horse that's exfoliating a lot of sole, that they can become more sensitive. But you're seeing them more sensitive with, well, I guess it depends, like maybe on the fact that you're in a more dry environment than I am. So maybe if they have,
exactly.
Yeah.
So yeah, if it's a horse that comes from irrigated pasture, I'm going to put it that way. I'm really careful about exfoliating that sole. But the thing is that horse is very prone to have subsolar abscessing.
Right. Because of the compaction of the layers of sole.
Because in between the layers of sole, you have that chalky material. And in that chalky material, the water goes in and is the perfect home for fungus and bacteria.
Yeah, microbes kind of eat away of it. Yeah. I mean, I know that when I've seen subsolar abscessing, when they actually burst the abscess and the layer of sole comes off, you can see an entire area that's just eaten away.
Exactly, because the water went in and made home for those organisms.
Yeah, right.
So it's a catch-22 sometimes. What you can do. That's why these environments that are wet are really hard on them. And that's why these environments that are where the horses are not moving, it's tough.
Yeah, for sure. Yeah.
And then, well, you can put something, a prosthetic or glue on or whatever, and the horse is going to feel more comfortable. But you have to be careful that if it's in a wet environment, you better put a good amount of Artemide.
Right.
When you do that, because if not, you're going to have a mess.
Right. You're just going to add to the problems. I know that I've seen that too. Even times when I've put a ton of thrush treatment, Artemide, clay, whatever, in glue-ons here, if it was a really wet year, it seems like the water just kind of infiltrated it and kind of made everything goopy inside anyway, even if I put, Artemide with dental impression material. But I haven't tried. I wonder if there's, I don't know if the felt would just hold moisture too, though, I guess, if it was something like that against the foot.
Well, this one that I'm using actually doesn't. I just pulled some glue. That's what I was late. I was in the mountains re-gluing a horse. And the hinds had a lot of moisture in them. I don't know why the fronts didn't, but the hinds had a lot of moisture. And that pad that I pulled off from the hinds were still a little dry.
Interesting. That's really so. But you had rain too.
Yeah, they had rain in the mountains. Yeah.
Okay.
But this is a horse that moves a lot in the how do you call it? It's hilly terrain. It's not flat.
Right. Yeah. That's like my property here is all one big hill.
Yeah.
Yeah. So I feel like it's good and bad sometimes because we get erosion and all these other issues, but at least we, have good hind end muscles.
Exactly. Yeah, and the horses are healthier in terrain that's like that.
Yeah, I mean, I hope so. That's what I aim for.
Yeah.
Awesome. Well, yeah, I think this is really good information, and I'm really excited because I'll see you at the PHCP conference, right, in Chicago in just a few months.
Yeah.
I can't believe it's just 2 months away, which is just crazy to me. I'm really excited about it this year, and it's always great to catch up with everybody and talk all these like nerdy hoof conversations.
Okay.
I think it's very good. It's a really good conversation for people that know the foot and want to know more about how to help these horses that they're struggling with, because that's something like I've been kind of beating myself up about one of these horses on my property that's just, she's been here 10 months and she just goes through these waves of just being uncomfortable. And she just has no, like her foot's just like flat and plattered and just not growing a good connection.
Yeah.
So
no, and it's crazy. There's one that I do that lives in pea gravel, dry.
Yeah.
This horse is a heavy horse. It's half draft, and if I would not bring those toes back and shape that hoof oftenly, it would just go. It will go out.
Yeah.
But when I come, I cannot take anything from the bottom because everything is polished. But at the same time, it's flat, but it's hard as a rock.
So the horse isn't sore?
The horse is not sore, and he's living in pea gravel.
Wow, that's awesome.
Discreetly. So, like you say, it all depends on many things.
Right. Yeah, for sure. Awesome. Well, thank you so much for being willing to do this. And
Okay.
this was great. And I will see you in a few months.
Okay, thank you.
All right. Have a good rest of your day or your night, whatever time it is. Yeah, night.
You too.
All right.
Thank you, Alicia.
No problem. Bye. I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.